There's a new drug in town. Drug policy experts say fentanyl, 50 times stronger than heroin, is moving east. Police say it's here to stay. It wasn't always this way, though. Tim Hogan worked with the RNC's Drug Enforcement Department for years. He says hard drugs like cocaine and heroin were once a rare sight.
Back in the 90s, you were seeing, pockets or small amounts of cocaine coming to the province. Not a lot that we were privy to. Marijuana at the time, hashish, pills, as in prescription medication. There was a lot of abuse of that.
Then, about 20 years ago, an influx of cocaine and OxyContin sparked a booming street trade, the likes of which the RNC had never seen.
As time wore on, some of the informants that I dealt with told me in the early 2000s that it was easier to get a gram of coke than it was a gram of weed at the time. And that's when the whole, for want of better terminology, the whole OxyContin craze started.
The RNC soon found itself playing a game of whack-a-mole, able to keep some drugs off the streets with major busts and having them pop up elsewhere.
We had great success. Unfortunately, you're never going to get rid of it all. But you can certainly have them looking over their shoulder and wondering if you are going to be there.
But one policy expert says the introduction of fentanyl has changed the drug landscape in recent years, making it harder to crack down on organized crime.
Drugs that are easier to make, easier to produce, easier to ship. And fentanyl, you just need a few people in a lab tinkering with some chemicals and you've got your powder made, and it's a very potent powder. It's easy to transport, whereas heroin, you need a whole field of poppies, a whole crew of people to produce it, and then you got to ship bricks of this stuff around the world. So this is directly a result of law enforcement efforts to prohibit one drug as they start getting it replaced with another.
The most recent data isn't pointing to an uptick in fentanyl's presence yet in Newfoundland and Labrador. These numbers from Health Canada show the number of samples collected by police that tested positive for fentanyl. And these are the reported deaths by opioid overdose. But Boyce fears those numbers could rise without regulating hard drugs and ensuring users know what's inside what they consume.
I can see why police want to get involved and disrupt those networks and try to limit that. But those guns and those gangs are there because of the black market, because of the illicit market. And if we look to have a regulated market, like with alcohol, we don't have guns and gangs related to alcohol. It's really time to start thinking about treating other drugs in the same way that we do with alcohol.
Malone Mullen, CBC News, St. John's.